Hi everyone, my name is Anna Gomez and I will be talking about schizophrenia. So schizophrenia is a spectrum disorder that confuses the brain into seeing or hearing things that are really not present. Burke-Charles, Cassini, and Bernstein state schizophrenia is a psychosis that is marked by a fragmentation of a basic psychological function, attention, perception, thought, emotion, and behavior that are normally integrated to help us adjust to the demands of reality. People with schizophrenia misperceive what is happening around them, often hearing or seeing things that are not there. How is schizophrenia diagnosed? In order to be fully diagnosed with schizophrenia, you will need to have the 5 symptoms of schizophrenia for 6 months. Some of the symptoms are hallucinating, speech impediment, obvious change in their behavior, such as if they are friendly and then they just become aggressive instantly with no control. That is also a sign. Showing no emotion or no sympathy or feelings, towards others. Poor hygiene, and also becoming antisocial. And of course, I mentioned that one already. So what are the causes of schizophrenia? So according to Burke, Charles, Cassini, and Bernstein, schizophrenia has no evidential cause. Researchers hypothesize that it can be genetic, drug use, or traumatic experiences. Burke, Charles, and Cassini, and Bernstein states the closer a person biological relationship to someone diagnosed with schizophrenia, the greater the person's risk of developing schizophrenia. So other causes may be gray matter in the brain, frontal lobes becoming smaller. When the frontal lobes become smaller, it is harder to problem solve and make decisions on your own, because this part of the brain is what mainly does the problem solving for us. So gender and schizophrenia. So females are less likely to have schizophrenia. It's more higher in the male. Females perform better cognitively. They're less aggressive, and normally schizophrenia is found from the ages of 25 to 30 in females. And then men have more severe symptoms. They're more aggressive. Cognitive performance is very low. And men actually have schizophrenia earlier in their life, which they start at the age of 10 years old to the age of 25. So Burke, Charles, Cassini, and Bernstein write, women have better treatment outcomes, interestingly, through gender differences related to symptoms, presentations, and age at onset are less evident in people living in non-Western and developing countries. Even though genders have the same condition, women are more likely to have fewer negative symptoms than men. Men have more severe episodes than women, and there was an experiment conducted on genders and schizophrenia. And so this is what was found. So patients are given antipsychotic medication to control the symptoms. A study was conducted by Bartolovic, Weisberg, and Ellie. They found that medication does not help alleviate symptoms. In the study, it showed that patients who were not on medication were able to perform better than those who were on medication. So therapy. So the types of therapies that some schizophrenia patients receive is psychological treatment. Is a psychological treatment that is known as CBT, which is cognitive behavioral therapy, and this usually helps with their behavior, their depression, or their anxiety, or if they have an episode and they don't know how to control it, or maybe a meltdown or a breakdown. This therapy assists with that. Now we have family intervention therapy, which actually helps the family deal with the family member who has the mental illness, how to work with a person who has schizophrenia. And that is all for today. Thank you so much. Definitely had a great semester, and wish good luck to everyone.